Hello. I am Dr. John, and this is the channel where health and longevity meet. Have you ever felt your body changing, but didn't exactly know what was happening? Irregular menstrual cycles, restless nights, or that sudden intense heat that seems to appear out of nowhere? These could be the first signs of menopause, and understanding what's going on is the first step toward taking better care of your health and quality of life. If you're between the ages of 40 and 55, this video was made for you. Today, we're going to talk about the 7 first signs of menopause that you need to know. This isn't just a list of symptoms, it's a practical guide to help you identify changes in your body and, more importantly, how to deal with them. This video could be the key to helping you seek medical support at the right time and avoid unnecessary discomfort. After all, recognizing early signs empowers you and prepares you to experience this phase in a healthy and calm way. So, tell me, have you noticed something different in your menstrual cycle? Any physical or emotional discomfort you're unsure about? Don't go away, because in the next few minutes you'll discover answers to these questions and how to turn this information into well-being in your daily life. Menopause is a stage that arrives silently but with clear signs that the body is transitioning. Many women still see this period as a taboo, something that happens to others, until they notice subtle changes in their routine, irregular cycles, restless nights, or even that feeling that something is different. It's a time that raises doubts and, often, concerns, but it can also be an invitation to reconnect with your body and take better care of your health. After all, understanding what's to come is one of the most important steps to go through this phase with ease and confidence. During the climacteric phase, which precedes menopause, the body starts giving signs that hormones are shifting. And this is not a cause for alarm, but for attention. Imagine your body is like an orchestra. Estrogen and progesterone, the conductors, are adjusting, and sometimes the instruments play out of sync. Understanding these adjustments can help you maintain emotional and physical balance. And you know what's best? Many of the measures that help during this period are simple, like improving your diet or including small breaks throughout the day to relax. Understanding menopause is like learning a new language. At first, it seems complicated, but little by little everything makes sense. More than just a phase, it's an opportunity to look inward and adjust what's not working. It's the moment to ask yourself, what does my body need now? Maybe it's lifestyle changes, or just paying attention to the details. But before knowing how to deal with it, it's essential to recognize the first signs. Point 1 of the first clues that menopause is approaching is the unpredictable behavior of the menstrual cycle. What was once as regular as a clock may begin to falter, with longer or shorter intervals, heavier or lighter flows. These changes may seem confusing, but they are part of a natural process in which the ovaries begin to reduce their hormonal production. It's like a subtle alarm from your body, asking for attention and care. Writing down the dates and patterns of your cycle can be a good strategy to identify what's changing and share this information with a doctor. Imagine a woman who always knew the exact day of her period. Suddenly, the cycle becomes a mystery. It arrives earlier than expected, or even disappears for a few months. This irregularity is typical of the transition to menopause, but it can also generate insecurity. That's why keeping a journal or using apps to track the cycle is so important. These records help understand whether the changes are normal or if something else needs to be investigated. After all, information is power, especially when it comes to your own body. These changes in the cycle not only signal the start of this new phase but can also impact energy in daily routines. After all, dealing with an unexpected flow during an important meeting or while traveling can be frustrating. The good news is there are ways to minimize the impacts, such as being prepared with hygiene products at strategic times and, most importantly, seeking medical advice when the changes seem extreme. Now that the cycle has given the first warning, other signs may begin to appear. Anyone who has experienced a hot flash knows how impossible it is to ignore. Suddenly, an intense heat sensation sweeps through the body, starting in the chest and rising to the face, even making the ears feel hot. It may last a few seconds or minutes, but it feels like an eternity. Hot flashes are one of the most classic signs of menopause and happen due to hormonal instability, which affects the body's natural thermostat, located in the brain. It's as if the body thinks it's facing 40-degree heat, even in the middle of winter, and it doesn't stop there. Many women report that the heat doesn't just happen during the day. At night, it turns into sweats that interrupt sleep. Imagine waking up with your pajamas soaked or having to change the bed sheets several times a week. This not only affects sleep quality but also mood and energy for the next day. At this point, it's essential to adopt practical strategies, such as wearing light cotton clothes, avoiding spicy foods before bed, and keeping the room cool with a fan or air conditioner. For those facing these changes, there's something even more important: understanding that you're not alone. Millions of women go through the same situation, and finding solutions may be simpler than it seems. From using calming teas before bed to practicing breathing techniques to relieve hot flashes, what really matters is testing and discovering what works best for each body. And when sleep is interrupted by these signs, other rest-related issues may arise and deserve special attention. A sleepless night once in a while might seem normal, but what about when it becomes a routine? During the transition to menopause, many women begin to face difficulties falling asleep or staying asleep throughout the night. It's as if the body becomes restless, even after a tiring day. This insomnia is often caused by hormonal changes that affect internal balance, leaving the mind and body in a state of involuntary alertness. The result? Waking up in the morning feeling like you haven't rested at all. Furthermore, sleep disturbances can worsen with night sweats, creating a vicious cycle. A woman may wake up multiple times during the night due to discomfort, leading to frustration and accumulated tiredness. During these times, simple strategies, like creating a relaxing bedtime routine, can be very helpful. Drinking a calming tea, reducing screen time an hour before bed, or even trying guided meditation techniques are practical measures to improve sleep. It's essential to understand that sleep is not a luxury but a vital need for both body and mind. When it's affected, mood, energy, and even concentration suffer the consequences. Seeking help from specialists, such as a doctor or therapist, can also be a big step in identifying personalized solutions. With compromised sleep, it's not uncommon for another symptom to appear more intensely: mood swings and irritability, which often arise as a direct reflection of this lack of rest. If at one moment you feel calm and then suddenly irritated by something trivial, know that this could be more than just a bad day. Mood swings are one of the most common signs of menopause, and they stem from hormonal fluctuations. Estrogen, one of the main regulators of mood, starts to decrease, and this can make the brain more sensitive to stimuli that would otherwise go unnoticed. It's like the body is adjusting emotional frequencies, but in a disordered way. These mood swings can be challenging, especially when they affect relationships or daily routines. Imagine being in the middle of a calm conversation and suddenly feeling a wave of irritation for no apparent reason. It's important to recognize that these reactions are not a reflection of your character, but rather a response from the body to internal changes. Strategies such as exercising, which releases endorphins, or even dedicating a few minutes of the day to mindful breathing, can help balance emotions. However, some women may feel these changes more intensely, leading to feelings of sadness or anxiety. In these cases, seeking support is essential. Talking to a friend, engaging in enjoyable activities, or even seeking therapy can be valuable steps to restore emotional well-being. When emotions seem out of control, other changes in the body also start to manifest, and one of them can be particularly uncomfortable for many women: vaginal dryness. Vaginal dryness is one of the less discussed symptoms, but it directly affects the well-being of many women during menopause. It occurs due to the decrease in estrogen, which plays a crucial role in maintaining lubrication and elasticity in the vaginal area. Without this hormone at adequate levels, the vaginal walls can become thinner and drier, leading to discomfort, especially during intimate relations. It's a sensitive topic, but essential to address with naturalness and information. This symptom can impact not only physical health but also emotional health, influencing self-esteem and relationships. Many women report avoiding intimacy for fear of pain or discomfort, which can create an emotional barrier in their connections. To minimize these effects, it's important to know that there are accessible solutions, such as using specific vaginal moisturizers or water-based lubricants. An open conversation with a gynecologist can provide personalized guidance and alleviate any concerns. Additionally, it's crucial to remember that intimate health care isn't just about products or medical treatments. Simple habits, such as avoiding scented soaps in the intimate area and prioritizing cotton underwear, can also make a significant difference. By facing vaginal dryness with knowledge and strategies, women take another step toward gaining control over this phase. However, as we address these issues, the body may signal another change: constant fatigue that seems endless. Who hasn't felt like fatigue follows every step of the day, no matter how much sleep you got the night before? Constant fatigue is another common symptom during menopause, and its cause is closely linked to hormonal changes and their impact on the body's metabolism. The decline in estrogen and progesterone levels can interfere with sleep cycles, energy production, and even the willingness to perform simple daily tasks. The body seems to constantly ask for more rest, and this may be a clear signal that something needs adjustment. The feeling of tiredness can intensify when combined with other symptoms, like hot flashes or sleep disturbances. Imagine if sleep is already interrupted by night sweats, and the next day you have to deal with a lack of energy, creating a difficult cycle to break. In this scenario, it's essential to focus on practices that help restore vitality. A balanced diet, focusing on iron and magnesium-rich foods, can be a powerful ally. Additionally, light physical activities, such as daily walks, can improve circulation and increase energy levels. The most important thing, however, is to recognize that fatigue is not something to ignore. If this symptom persists, it's essential to consult a doctor to evaluate other possible causes and find the best treatment. Constant fatigue can be debilitating, but by understanding its origins and seeking alternatives, it's possible to take another step toward controlling menopause. And, while dealing with the lack of energy, many may notice that another issue begins to arise: joint pain and even the loss of bone mass. As the years pass, especially during menopause, many women begin to experience increasing discomfort in their joints, as if small movements cause sudden and intense pain. This symptom occurs because the decline in estrogen levels also affects bone density and joint elasticity. The loss of bone mass, which can lead to osteoporosis, makes bones more fragile and susceptible to fractures. With this, mobility can be limited, generating a sense of helplessness and constant discomfort. What many women don't know is that with a few simple lifestyle changes, it's possible to prevent or even minimize the effects of bone loss. Physical exercise, especially activities like weightlifting and walking, help strengthen bones and improve joint flexibility. Additionally, adequate intake of calcium and vitamin D is crucial for bone health. Incorporating foods like dairy products, dark green vegetables, and fatty fish into your diet can be an excellent way to provide the body with what it needs. However, if joint pain and bone density loss are intense, don't hesitate to seek a specialist. A doctor can recommend supplements, physical therapy, and even medications that help restore joint and bone health. By dealing with these symptoms, it's possible to regain quality of life and continue with an active and healthy routine, facing menopause in a more balanced and controlled way. And as you take care of your bones and joints, the next step will be to understand how to maintain balance between body and mind, as all these processes also directly impact emotional and psychological well-being. Reaching menopause may seem like a challenge, but as we've seen, recognizing the signs and understanding the impacts this phase has on the body is the first step toward living a healthy and balanced life. Knowing the symptoms of menopause, such as changes in the menstrual cycle, hot flashes, insomnia, mood swings, vaginal dryness, fatigue, and joint pain, empowers women to seek effective solutions and make lifestyle adjustments. The body is undergoing natural changes, and what matters is not letting these changes negatively affect quality of life. It's crucial to adopt healthy habits that help balance hormones and improve overall health. Regular exercise, a nutritious diet, and mental health care practices make all the difference. And of course, seeking medical support is essential for proper guidance and treatments. Don't hesitate to seek help from professionals who can offer the best solutions for your case. Remember, you are not alone on this journey. Now, how about starting to apply some of these tips into your routine? How can you improve your diet or include more regular physical activity? Menopause can be a challenging phase, but with the right knowledge, it can be lived with much more comfort and well-being. If you like this content and want to keep learning more about taking care of your health during menopause, subscribe to the channel and turn on notifications to stay up to date with everything. Let's go together on this journey of self-knowledge and quality of life.